Esophageal stenting for benign and malignant disease, European Society of Gastrointestinal Endoscopy, ESGE Guideline, Update 2021. Introduction. Esophageal cancer is the seventh most common cancer type worldwide, with a global incidence of 604,100 new cases in 2020. The main symptoms of esophageal cancer include dysphagia, with concomitant weight loss, and odynophagia. Because patients with esophageal cancer are usually asymptomatic in the early stages, more than half of patients are diagnosed at an advanced stage of the disease and are not eligible for treatment with curative intent. One of the main goals of palliative treatment is to relieve dysphagia and improve nutritional intake. A variety of therapeutic options are available, including external beam radiation therapy, EBRT, brachytherapy, and esophageal stent placement. Esophageal stent placement is preferable in patients with an expected short-term survival because of its rapid relief of dysphagia symptoms. Different stent designs are available, varying in stent material, plastic, metal, covering, diameter, and anti-migration features. Partially covered self-expandable metal stents, PCSEMSs, and fully covered self-expandable metal stents, FCSEMSs, are most often used in current practice. In addition to their use for the palliation of dysphagia, esophageal stents can be used for the treatment of benign esophageal diseases. Stents are usually removed after several weeks, as this time frame allows for the resolution of disease and safe stent removal. FCSEMSs have been mostly used for the treatment of benign disorders. In recent years, biodegradable stents, BDSs, have gained increasing attention for obviating the need for stent removal. This is an update of the clinical guideline on the use of esophageal stents for benign and malignant disease issued in 2016 by the ESGE. In this guideline update, the current evidence will be discussed and recommendations on the use of esophageal stents will be provided. Main recommendations. Malignant disease. ESGE recommends placement of partially or fully covered SEMSs for palliation of malignant dysphagia over laser therapy, photodynamic therapy, and esophageal bypass. Strong recommendation, high-quality evidence. ESGE recommends brachytherapy as a valid alternative, alone or in addition to stenting, in esophageal cancer patients with malignant dysphagia and expected longer life expectancy. Strong recommendation, high-quality evidence. ESGE recommends esophageal SEMS placement for sealing malignant tracheoesophageal or bronchoesophageal fistulas. Strong recommendation, low-quality evidence. ESGE does not recommend SEMS placement as a bridge to surgery or before preoperative chemoradiotherapy because it is associated with a high incidence of adverse events. Other options such as feeding tube placement are preferable. Strong recommendation, low-quality evidence. Benign disease. ESGE recommends against the use of SEMSs as first-line therapy for the management of benign esophageal strictures because of the potential for adverse events, the availability of alternative therapies, and their cost. Strong recommendation, low-quality evidence. ESGE suggests consideration of temporary placement of self-expandable stents for refractory benign esophageal strictures. Weak recommendation, moderate quality evidence. ESGE suggests that fully covered SEMSs be preferred over partially covered SEMSs for the treatment of refractory benign esophageal strictures because of their very low risk of embedment and ease of removability. Weak recommendation, low-quality evidence. ESGE recommends the stent-in-stent technique to remove partially covered SEMSs that are embedded in the esophageal wall. Strong recommendation, low-quality evidence. ESGE recommends that temporary stent placement can be considered for the treatment of leaks, fistulas, and perforations. No specific type of stent can be recommended, and the duration of stenting should be individualized. Strong recommendation, low-quality evidence. ESGE recommends considering placement of a fully covered large-diameter SEMS for the treatment of esophageal variceal bleeding refractory to medical, endoscopic, and/or radiological therapy, or as initial therapy for patients with massive bleeding. Strong recommendation, moderate quality evidence.